So currently we have 2,494 people in hospital, including 160 people in ICU, 75 of whom are ventilated. There were 10,698 positive test results returned, including 6,122 positive rapid antigen tests and 4,576 positive PCR tests. Those PCR tests, those 5,576 positive PCR tests, were from around 39,349 PCR tests. So the data we release on Fridays, we release the updated modelling data which is attached, and it is pleasing to see that we are seeing declines in new hospital admissions. ICU is also declining. You will note that the number ventilated does still remain at a more constant level, and we expect that to be a little bit slower in declining because a number of the patients have got longer length of stays in ICU when they are ventilated, but we will see that number come down as well. The health system continues to be working very hard, and when I say the health system, I mean the GPs, the pharmacists, the allied health professionals, the public hospitals and the private hospitals. They're doing lots of tasks, and I just want to acknowledge the great work they're doing, particularly all of the efforts to provide health care to all people and also roll out the booster program. The Premier's indicated the importance of that. I'm going to talk a little bit later on about the death summary that I do provide, and again that has some salient messages for people emphasising the importance of vaccination and booster doses. Today we're announcing the death of 31 people with COVID, 21 men and 10 women, and can I express my condolences to families for their losses. Of the 31 people who died, one person was in their 60s, 7 were in their 70s, 12 were in their 80s, 10 people were in their 90s, and one person was aged 100. In the period Friday to the 28th of January to the Thursday the 3rd of February, we've had 253 deaths, one person in their 30s, 4 in their 50s, 18 in their 60s, 50 in their 70s, 108 in their 80s, 68 between 90 and 99, and 4 over 100 years of age. 136 were aged care residents, and of the 253 deaths, 52 were unvaccinated. 6 had received 1 dose, 149 had received 2 doses, and only 46 had received 3 doses. So the vast majority of those over age 70 had not had their booster, and overall only 18% of all of the people who died had had their booster, despite the older age profile and the underlying health conditions. There were 13 deaths in the period for those under 65 years of age, and 1 person was in their 30s, 4 in their 50s, and 8 were in their early 60s. 10 were males and 3 were females. 4 were unvaccinated, 1 had had 1 dose, 7 had 2 doses, and 1 had had 3 doses. And the person with the 3 doses had a very severe existing immunocompromise. So just to give a sense of the comorbidities, or what we talk about is the underlying health conditions, you'll see this matches the information I've provided previously. 6 people had diabetes, 4 were obese, 4 had cardiac disease, 3 had significant immunosuppression, 2 had renal disease, 1 had severe liver disease, and 1 had a cancer, and 2 had obstructive sleep apnea. So clearly what this highlights is that those that are elderly and those that have underlying health conditions are most at risk for severe disease, hospitalisation and death. But the other salient message is that boosters are effective, and I would like to urge everyone, particularly those with underlying health conditions and those that are elderly, to really, as a matter of urgency, get boosted if it's 3 months since your second dose. And for some of those individuals with immunocompromise or undergoing chemotherapy, they will require 4 doses, 3 doses as part of the primary course and a 4th dose. So please, if you have chronic underlying health conditions, check with your GP and pharmacist, but you may require 4 doses to have completed your schedule for vaccination. Thank you.